Janice Dada, a dietitian specializing in eating disorders, diabetes care, and intuitive eating. Janice shares her journey and explains how intuitive eating offers a fresh, non diet approach to managing health. We explore how this framework works alongside chronic illness, dietary restrictions, and cravings, and discuss the importance of listening to the body's hunger and fullness signals. Janice also offers insights into the future of intuitive eating in chronic illness management. Stay tuned. Janice Dada specializes in helping families and individuals of all ages optimize their health, well being, and eating behaviors through a weight inclusive, non diet framework. Her book, Intuitive Eating for Diabetes, is available for pre order now and will be published in April of 2025. Welcome, Janice.
Thanks so much for having me.
Such a pleasure having you on. So, Janice, I want to start out with your why. Can you tell us a little bit about your journey to becoming a dietitian, specializing in eating disorders, diabetes care, intuitive eating? Like, how did all that happen? What was your journey like into this?
Sure, absolutely. So I became a dietitian in 2007. I did my internship with the VA and then went to work for the VA initially. And it was a great experience in many ways, worked with many patients with diabetes. And after a couple years, I just found myself craving a bit more independence with my schedule. I wanted to do things in the community, like I ended up teaching some college nutrition classes. And I also wanted to counsel patients differently. I found that there was sort of a very prescriptive way that patients were being counseled with diabetes.
Mm.
And it was also a very weight-centric, kind of top-down approach. We also had very little time with patients. And so I just sort of craved a little bit more independence with how I was going to do things with patients. So after about 2 years at the VA, I left and went to private practice and then was also teaching those college nutrition classes. And I started doing some additional training. I worked with Evelyn Tribole, co-author of Intuitive Eating, and did some mentorship and some of her um, training programs. And I also ended up doing more client-centered counseling training, motivational interviewing. And so without really seeking out eating disorders, they came to me. And so I also embarked on some additional training within that realm because I found that that was really a big need, especially as it related to people with medical conditions, such as diabetes. So I, started doing more with regards to intuitive eating and bringing that approach to diabetes. And intuitive eating with diabetes really allows clients to listen to their inner signals while making choices that work for their own personal blood sugar management rather than following something very prescriptive and prescribed that is not necessarily needed or necessary for each individual.
And that's really the topic for our discussion here today is really understanding that intersection of both intuitive eating and diabetes, which takes me to my first question. Now, we've talked about intuitive eating with a few guests before. My question to you is first, just help us understand or reestablish the basics of intuitive eating. It sounds simple, but I know it's not, but please walk us through that first. And then, how does it differ from traditional diabetes management approaches? Because we hear about diabetes management and, sort of managing the types of even foods that you're eating and consuming through that. Walk us through that.
Yeah, absolutely. So, intuitive eating is a way of eating that brings together instinct, emotion, rational thought. There are 10 principles. I think sometimes, people kind of boil it down to something very simplistic, but as you mentioned, it is 10 principles, not just like hunger and fullness, which are two of the 10 principles. And they eating intuitively helps people to focus on their internal cues and aiming to move away from dieting and external rules that almost always backfire and moves them also towards more positive self-care. And so there's over 200 published research studies looking at intuitive eating specifically, and a number of those have also looked at intuitive eating in diabetes. Um, One of the researchers named Tracy Tilka, who actually developed the intuitive eating assessment questionnaire, which people can take and just sort of assess their own intuitive eating skills. She found that intuitive eating was associated with greater weight stability. And that is really critical because weight cycling is something we know that happens when people diet or restrict their food. And weight cycling is just weight jumping up and down. And so weight cycling is actually a known risk factor for diabetes and other metabolic and psychological health outcomes. So that's really crucial. And so really, when we think about kind of what's typically done in diabetes care is weight normative care, which is healthcare that focuses on weight as like the cornerstone to their treatment. And so intuitive eating allows us to use a weight inclusive approach, meaning that we're not actually using weight as the cornerstone to our treatment at all. And rather, we're using health behaviors to help people move towards ways that they may be able to improve various outcomes. And so with diabetes, specifically blood sugar management.
And can you walk us through what traditional diabetes management tends to look like and how intuitive eating just really plays a different role within that?
Yeah. So traditional diabetes management often focuses on weight. So whether somebody, regardless of where somebody is on the weight spectrum, I find that often weight is a focus. Often physicians will use the BMI, which has a number of problems, but they may be given instructions to lose weight without any sort of um, real recommendation as to how to do that, just sort of like do it as if it's this easy thing to do. And in addition, often diabetes care or the kind of the traditional diabetes care comes along with like carbohydrate restriction. So I've had clients come in and say, like, my doctor told me to lose weight and not eat anything that's white. Um, really not very clear guidelines, and also makes patients feel very shamed and blamed, and all, sort of like they've done something wrong, that they must be eating the wrong way, and that's why they have this blood sugar issue, or they must be at the wrong weight, and that's why they have the blood sugar issue, which is really not the case, because we know that diabetes occurs for a whole host of reasons. And that could include things like genetics, their environment, exposure to things like pesticides, their trauma history, their sleep patterns, like, the list goes on and on in terms of like the root causes of why diabetes occurs. And so those sort of just blanket statements of do this and your blood sugar will get better, and if it doesn't get better, you must have done it wrong, really doesn't help patients to move in the right direction. So I have worked with patients that have both taken it way too far and their restriction has ended up in a clinical eating disorder. And I've also worked with patients who have said this is impossible and thrown in the towel and said, like, whatever happens, happens. I can't do what this, practitioner has told me to do.
You mentioned about weight there for a second, and I know you take a very weight inclusive framework. Can you explain what this non-diet weight inclusive framework really entails and why it's so effective for long-term health and well-being, including diabetes?
Yeah, so a weight inclusive framework focuses on health behaviors rather than weight. And so that might mean that we're working on, sleep patterns, for example, because we know that sleep actually really affects blood sugar management. So whether it's like undiagnosed sleep apnea, so I might ask questions of my patients about how they feel in the morning when they wake up, how they feel throughout the day, how well they're sleeping at night, if they're having trouble falling asleep or staying asleep, if they have a partner who says that they are snoring or that they sound like, they are struggling to breathe while they're sleeping, then we might do, a test for sleep apnea, which can, with the treatment for sleep apnea, really actually have a big impact on blood sugar management. Or we might look at joyful ways to move the body. So there's actually been some studies that have looked at the idea of exercise snacks, which are like these little breaks in movement throughout the day. I think sometimes people get in their mind, like, if I don't do X amount of minutes all at once, it's like not worth it. But actually, the research finds that exercise snacks, little like 10-minute increments throughout the day, are just as effective as doing something all at once, and actually maybe even better because it interrupts periods of prolonged sitting. So that might mean a 10-minute walk a couple times during the workday, which can have multiple benefits, right? Because we also then get to take a break from our work, which can make us more productive, and we may be helping our blood sugar and getting some stiffness out. So, that's something that we might look at with people, to really understand, first of all, what kind of ways do you like to move your body? Sometimes their idea of movement has been tarnished by, just kind of diet culture in general, thinking that there's specific ways that are right or wrong to move. I had a client who rediscovered her passion for soccer when trying to make herself use like a treadmill and just didn't find that enjoyable. So she was avoiding it. But then when she realized like I could actually join like an adult soccer league, did that and found that was um, so much more fulfilling than making herself do something that she thought she was supposed to do.
And I love the concept of also making fun along the way. It shouldn't feel like burdensome and I have to do this one other thing that I have to intentionally carve out time. It can be fun at the same time as well, is
Hmm.
what you're saying. I love that
Yeah,
approach.
absolutely.
What can this look like for someone with diabetes who is new to intuitive eating? Where do you tell them to start? Where do you begin? You mentioned 10 principles. Do I do all 10? Like, walk us through what some initial steps look like.
Yeah, I actually love to take clients who are new to intuitive eating through the assessment questionnaire that I mentioned was created by researcher Tracy Tilka. I actually have it posted on my website too, so people can take it and then kind of see where their results fall. And so that can highlight some areas. So that can tell me if they are have a lot of food rules or if they are eating things that are not satisfying to them, or if they find themselves to be eating um, with sort of an emotional base behind the reasons for their eating. So that may also point us to like, where do we start first? Because, yeah, the 10 principles don't have to be done sequentially, although the last principle, gentle nutrition, is ideally not done in the beginning, because the idea being that we've really kind of worked through some barriers to attunement along the way. And the barriers to attunement are essentially these things that get in the way of us really like hearing and listening to our own body signals. So, for example, if we are not eating enough throughout the day, then we may end up overdoing it at some meals. And then some people will think, I'm an emotional eater, when really they're not an emotional eater, they're just hungry, right? And so we eat differently when we are overly hungry. So that could be something that we start with. I know Elise Resch, the other co-author of Intuitive Eating, likes to start with satisfaction because that is the hub of intuitive eating. So sometimes we could start there, where, for example, let's say somebody's eating their lunch at their desk and their desk is cluttered and people are calling them on the phone in the middle and interrupting them. And then they're getting, emails that are popping up and they're really not having an enjoyable lunch experience. We might just say like, hey, is there somewhere you can go sit outside away from your desk and have, 10 minutes quietly and peacefully to eat your lunch? And that could make, a difference in just the way that they're being able, or the way that they're able to be satisfied from that meal. So we could really start anywhere. Essentially, we just don't start with gentle nutrition in most cases, although I will certainly give clients sort of framework around like what would go into a meal so that you can feel satisfied with regards to all the food groups and whatnot. Does that make sense?
It does. And I'm almost also tempted to talk about maybe if there's a flip side to this. So we've been talking about the pros of intuitive eating and diabetes management. Are there any cons? Are there things that we need to be mindful, aware of as we explore intuitive eating, in diabetes?
Yeah. So something that we should be aware of are potentially like medications that somebody might be taking that impacts their ability to feel hunger. So that could be somebody who's taking a medication, say for like ADHD, which some of those medications do cause some period of time throughout the day where there's just blunted hunger. Also, some of the diabetes medications that impact somebody's sensation of hunger. So I might work with somebody to sort of understand the hunger first, but if hunger doesn't come in the time frame, as say is like there's been 3 to 5 hours that have passed between a meal, then we've got to use the clock. So, kind of really helping them to understand, to fuel their body, not only their hunger, And in another situation could be also somebody who's recovering from an eating disorder who may also have kind of some blunted hunger signals. So we say, so if hunger signals essentially are offline, then we need some framework or structure around kind of creating that pattern of eating.
Can intuitive eating also exist with, and I feel like I know the answer, but I feel like I should also ask, but can it also coexist with specific dietary restrictions like vegetarianism, veganism, any other kind of restrictions?
Yeah, absolutely. So um, certainly, and that is actually why I wrote the book Intuitive Eating for Diabetes, because I would get people asking all the time, well, I can't, can I eat intuitively if I have this going on? And I actually had a patient who I do discuss in the book who I worked with him on intuitive eating first, and then he was diagnosed with diabetes, and he kind of came back to me and said, like, what do I do now? I'm being given all this, information that's kind of different than what we had worked so hard on. And so, absolutely, we can use all of that, like with, say, a food allergy or a particular cultural way of eating. We essentially just change the food that we're consuming in order to match what that particular need is. So, for vegetarianism, of course, we would swap out what we're swapping out in terms of protein sources to match a vegetarian diet. But also, this is where gentle nutrition comes in, kind of being cognizant of what might be missing in terms of vitamins or micronutrients in not eating a particular food. So, like for example, my son has a dairy allergy, so I know that I've got to pay extra attention to calcium and magnesium and vitamin D for him. So we, just kind of add that in where we need it. But then, of course, he needs to avoid dairy because he is allergic to it. So we certainly can adapt, I think, any medical condition to be eating intuitively.
And, as you're mentioning about intuitive eating, I feel like it's such a mind body connection. You really have to be attuned to those cues. Is there any room, or do you find it to where patients come back to you and still talk about struggling through cravings, temptations for salty snacks, or, sugar, processed sugared foods, like, those types of things? Is it possible to one have those types of temptations, and then again, where do you go with intuitive eating if you are craving those types of foods?
So there's no off limit food. And I think sometimes that gets interpreted incorrectly because sometimes I think people think like it's the eat whatever you want without regard kind of philosophy around eating, which is not true because then that wouldn't be intuitive, right? So a lot of times we have to really work on making peace with food, another one of the intuitive eating principles, to feel I guess that there is really not that strong pull towards a particular food, that we're sort of habituating to it. Habituating meaning it's like no big deal, which, so for example, I give an example of a client I worked with also in my book who had what and this is where people might come in and say, I'm addicted to whatever it is, right? And so that's where we might want to walk back and say, like, are you addicted to it or do you feel addicted to it? Because actually, we don't have good data to show that there is true food addiction because we need food to survive. It's not like a drug or alcohol addiction where we actually need to abstain from it to survive if there's an addiction. And so, for example, I had a client who I was just mentioning who felt like every time he ordered Chinese food, he would just go nuts with it. And this was the way he described it to me. He just felt like he couldn't trust himself around it. And so he'd try to avoid until he ordered it again. And then it was sort of this cycle. And so what we did was aimed to make peace with Chinese food by building in some structure and strategies around it. So, we sort of made a plan to, we're going to order Chinese food sort of indefinitely. But here's the thing, we're going to put it on a plate. You're going to give yourself full permission to go back and get more. But before you go back and get more, can you check in with your body and see how you're feeling? Knowing also that you can eat this tomorrow and the next day and the next day, like it's not going away. So a lot of times that scarcity mentality comes in to really make people feel like I've got to have it now. I've got to have it now. In addition, feeling like a food is like quote unquote healthy or unhealthy gives us that feeling too. And so, really allowing somebody to really recognize that all foods fit and we can eat them when we feel like eating them, but are we really eating that food because we want it or because we think we're not going to get it tomorrow or the next day, or this is our last time to eat it, kind of that last supper mentality. Does that make sense?
And I think, yeah, and what you're saying there resonates so strongly because there is a little bit of that. Like, if I don't eat it now or if I don't finish it now, like, I won't have it later. I won't have this opportunity again. It's like this denial that's coming up. So I might as well try to make up for it. But if you go through that cycle and you work through it, well, even as much as you eat it at one time, it's still not going to stop the craving later. So, what are you really, sort of filling up on that one item for? I really like that approach around the scarcity mentality and sort of like trying to get ahead on that. But if instead we were to open up, just the possibilities, then it's like, well, it's not scarce. I can have it whenever I want to, and now maybe I don't want it as much. I
Right.
love that
Yeah.
approach. Where do you see the field of intuitive eating and non-diet approaches really heading? So we hear a lot about this today, but help us sort of see, down the road, a few years out, where does this go next, particularly in the context of chronic condition management?
Yeah, well, as I mentioned earlier, there's over 200 research studies highlighting the benefits of using an intuitive eating approach, and a handful of those have also been studies that have intuitive eating with respect to diabetes care in terms of the focus. So I'm optimistic that the body of research will continue to grow as it has been growing. It's really been growing steadily over the years since the first intuitive eating book was written. And so hopefully more practitioners will get on board. I'm very hopeful when I see practitioners, including medical doctors, that have taken a weight inclusive approach, especially endocrinologists and primary care, because they are, at least with diabetes, they are the people who are usually going to be kind of the first person in line to see somebody who has, labs in a particular range, that they have concerns about blood sugar. So, as I mentioned, I was motivated to write Intuitive Eating for Diabetes because there's no other book addressing this topic. If you looked up, diabetes books, you would find just kind of a whole host of books that are telling you various ways to restrict, which, what we know from from people's own experiences and from research just doesn't work. A dietitian colleague friend today actually just forwarded me a study that was done. In the study, they limited carbohydrates to 9% of the intake, which, for those of you listening, we need at least usually like 45 to 60% of our intake to be carbohydrates. And so even if there's studies showing that, say like blood sugar will be better with this very restrictive approach, the bigger question is how long can somebody actually sustain that? And when they don't sustain it, then what do they do? Is that sort of then again the all or nothing approach, where I've certainly seen in my own practice that somebody feels shamed and blamed that they weren't able to do this extremely challenging approach to their healthcare, and then they kind of throw in the towel. Right. And so that's what I hope research continues to do, is actually look more long term, like who are the people that dropped out of this study? And have you followed these people for 5, 10 years? And so, of course, we need research dollars so that we can kind of look at, how that cycle of, if there's weight cycling or if there's dropouts from studies, or if they're continuing to be able to use this highly restrictive approach, because that's often what healthcare practitioners who come back and say, but the research shows, what they're often talking about is short-term research where we don't know what happened, years and years down the road.
Super helpful. With that, Janice, we are wrapping up and we are toward the end of the episode. At this point, though, I would love for our listeners to know how they can connect with you, learn more about your work. You mentioned your website earlier. Tell us how we could connect.
Yeah, absolutely. So my website is socalnw.com. That's my private practice website. And I do have a tab that links to pre-order for my book, as well as a place where interested people can subscribe. And so you can go there, or you can follow me on Instagram, which is my handle is SoCalRD.
Love it. Thank you so much, Janice, for your time. It was such a pleasure talking to you and learning more about this intersection again of intuitive eating and diabetes and just chronic care management in general. To our listeners, thank you for tuning in to another episode of the Yumlish podcast. Thank you so much for spending time with us. Head over to our social media and answer this quick question to tell us, have you ever tried intuitive eating? What has that looked like for you? We'd love to learn more about your experience there. Again, head over to @Yumlish on Instagram, on Facebook, find this podcast post, comment below to tell us again, have you ever tried intuitive eating and what that experience has looked like for you? We will continue the conversation there. With that, Janice, thank you again for your time.
Thank you.